Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: how long does Valium stay in your system? Valium, diazepam, can be addictive, even when used as directed. Don't stop taking it without consulting your doctor, as withdrawal symptoms can be severe. Continue reading about how long does Valium stay in your system. How long does Valium last? And how long does Valium take to kick in? What is Valium? Valium is often prescribed to relieve anxiety, muscle spasms, and seizures. It is also used to ease uncomfortable symptoms of alcohol withdrawal. Valium works by diminishing hyperactive brain function to relieve severe stress and anxiety. It is ingested orally in pill form and is usually taken 1-4 times daily when prescribed by a doctor. Valium is a long-acting benzodiazepine. This means it stays in the body much longer than shorter-acting benzos like halcyon. Because of Valium's long-lasting nature, people can take fewer daily doses than they would with shorter-acting benzos. Valium for anxiety is meant to be taken regularly to be effective. But when someone starts taking Valium more than prescribed or without a prescription, they increase their risk of becoming addicted. Internationally, Valium is classified as a Schedule IV controlled substance under the Convention of Psychotropic Substances. The restrictions placed on this drug make it more difficult to obtain a prescription and restrict the number of prescriptions doctors can give. However, the recreational use of Valium continues. It's typically dispensed in pill form but can be crushed to be snorted or melted into a solution for injection. When injected, Valium's effects take as little as a minute to appear and last for about an hour. How long does it take to feel Valium's effects? Valium, diazepam, is a medication that regulates brain chemicals that can cause anxiety and muscle spasms. Here's a general guideline of how long Valium takes to kick in. When taken orally, about 30 minutes to an hour. When taken rectally, within 15 minutes. When administered intravenously, IV, within 5 minutes. Valium's onset times can vary based on individual circumstances such as metabolism, liver function, and the individual's response to the medication. It's recommended only to take Valium as prescribed by a healthcare provider and to avoid alcohol or other substances that can increase the risk of side effects or dependency. If you have any concerns or questions about taking Valium or how long does Valium take to kick in, it's best to consult a healthcare provider. They can provide guidance on the medication's appropriate dosage, administration, and potential side effects. How long does Valium stay in your system? Curious about how long does Valium stay in your system? It's an essential question, as overdosing on Valium or combining this sedative with other central nervous system depressants can be dangerous. Plus, if you're undergoing a drug screening, you may want to know how long it takes for Valium to leave your system. And if you're dependent on Valium, understanding when withdrawal symptoms could arise is crucial. Valium half-life. Want to know how long does Valium stay in your system? Understanding Valium's half-life is a good first step. Valium's half-life measures the time it takes to eliminate half the initial amount in your system. Typically, it takes 5 half-lives for Valium to leave your system fully. Moreover, Valium's half-life is longer than other drugs in its class, ranging from 24-48 hours. This means a dose can take up to 10 days to leave your body fully. Valium also breaks down into other substances that can linger in your system and appear in drug screenings. One of these metabolites, known as nordiazepam, can stay in your body for up to 25 days. The length of time Valium, diazepam, stays in your system can vary depending on several factors, including age, weight, liver function, and dosage. Here's a general guideline on how long does Valium stay in your system. Blood, up to 48 hours. Urine, up to 4-6 weeks. Saliva, up to 10 days. Hair, up to 90 days. These are typical ranges and may differ based on individual circumstances. Factors such as frequency of use and the method of administration can also affect how long Valium stays in your system. It's recommended only to take Valium as prescribed by a healthcare provider and to avoid taking it longer than necessary to minimize the risk of side effects and dependency. If you have any concerns about Valium use or how long it stays in your system, it's best to consult with a healthcare provider. Factors that affect how long Valium stays in the system. How long does a Valium stay in your system? Various factors can influence how long Valium remains in a person's system, including body fat, age, dosage amounts, other medications, and substance use. Body fat. Valium is a highly lipophilic drug, meaning it prefers to settle into fat tissue and does not absorb well into environments with a lot of water. Therefore, Valium typically stays in the system longer if a person has more body fat. Drug interactions. Diazepam is mainly metabolized in the liver by different metabolic enzymes. If you are taking drugs that interfere with these enzymes, it may take more or less time for diazepam to be metabolized. Drugs that commonly interact with Valium may include opioids. This class of medications includes hydrocodone, oxycodone, fentanyl, and heroin. Taking opioids and Valium together is extremely dangerous and can lead to respiratory depression. Alcohol. Mixing alcohol and Valium increases the risk of overdose and death. Antacids. These types of drugs increase the time it takes Valium to start working. Drugs that interact with cytochrome 3A4 include ketoconazole, fluvoxamine, and fluoxetine. Ask your doctor or pharmacist for a full list of interactive medications. Phenytoin. This anti-seizure medication can reach toxic levels if taken with Valium. Dosage and frequency. In general, a drug's half-life is the same, regardless of dosage. Because diazepam has a 48-hour half-life, and it takes 5 half-lives for the body to eliminate a drug, diazepam is usually cleared within 10 days. However, since diazepam can accumulate in fat tissue, repeated doses can cause the drug to accumulate and increase its half-life. These effects would not be evident after taking just one dose. However, if someone takes diazepam every day for weeks, then the half-life will increase. Age. Older adults tend to have different types of body tissue than younger adults. In particular, older adults have more fat tissue and less lean muscle tissue. Because of this, diazepam is likely to stick around for longer in people aged 65 or older. Valium addiction. Valium is an addictive benzodiazepine with longer-lasting effects than other drugs in its class. Valium addiction can progress quickly if the drug is used in a way not directed by a doctor. Over time, it is harder for a Valium abuser's brain to function normally without the drug. Yet some people addicted to Valium may not even realize they have a problem. Taking Valium for longer than 4-6 weeks, even with a prescription from a doctor, increases the likelihood of becoming addicted. One of the telltale symptoms of a Valium addiction is needing larger doses to feel the drug's effects. Other signs of Valium addiction include strong cravings for the drug, isolation from family and friends, continued use despite problems caused by the drug, loss of interest in once enjoyable activities, ignoring obligations. Once a user tolerates Valium's effects, they could also have withdrawal symptoms if they stop taking it. Valium withdrawal can be dangerous and uncomfortable, which makes it hard for addicted people to quit on their own. The withdrawal symptoms are intense, and many people addicted to Valium need the drug to feel normal. People suffering from Valium addiction often put their addiction ahead of their professional and personal obligations. They are also likely to become unmotivated and lose interest in hobbies they once found pleasurable. We Level Up Rehab Treatment and Detox Center can provide you, or someone you love, the tools to recover from this condition with a professional and safe detox process. Feel free to call us to speak with one of our counselors. We can inform you about this condition by giving you relevant information. Our specialists know what you are going through. Please know that each call is private and confidential. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.